What to do before a T-SPOT.TB test? If you or your healthcare provider are thinking about a T-SPOT.TB test, it's important to know what steps to take beforehand to get the most accurate results. This test is a blood-based method used to help diagnose tuberculosis infection by measuring how your immune system reacts to TB bacteria proteins. Unlike the skin test, it's processed in a lab, so proper sample handling is key. First, talk with your healthcare provider about your medical history, any symptoms you might have, and possible exposure to TB. This helps determine if the T-SPOT.TB test is right for you. You do not need to fast or stop taking medications unless your doctor specifically advises you to do so. In most cases, you can continue your regular routine without restrictions. When it comes to the blood draw, the process is straightforward. A trained healthcare professional will collect a blood sample from a vein in your arm. For adults, this usually involves a single tube of blood, often collected in a green-top lithium heparin tube. If you are a child, the volume of blood taken will be less, but the handling rules stay the same. Timing is important. Blood should be drawn on a weekday, from Monday to Friday, to ensure the sample can be processed promptly. The sample must be kept at room temperature and should not be refrigerated, frozen, or spun in a centrifuge before testing. These steps are crucial to preserve the white blood cells needed for the test. Once collected, the sample needs to be transported quickly to the laboratory, ideally within 24 hours. Any delays can compromise the quality of the test and lead to unreliable results. Proper labeling and packaging are also essential. Make sure the tube is correctly labeled and placed in the appropriate specimen bag, following the lab's instructions for shipping. Remember, the test must be performed in a clinical setting by trained professionals. Home testing kits are not available for the T-SPOT.TB test. After the test, your healthcare provider will review the results with you. A positive result indicates TB infection but does not confirm whether the infection is active or latent. Additional tests like chest X-rays or sputum tests may be needed to clarify your condition. Following these steps helps ensure your blood sample remains valuable and the results are accurate. Proper collection, handling, and transport are vital because the test depends on living white blood cells in your blood. If the sample isn't managed correctly, the results might be invalid or misleading. Always consult your healthcare provider for personalized advice and guidance. They can help interpret your results and determine the next steps based on your overall health and risk factors. In summary, before a T-SPOT.TB test, you should discuss your health history with your doctor, have your blood drawn on a weekday, ensure proper handling and quick transport of the sample, and follow up to review your results. There are no special dietary restrictions or medication changes needed, but attention to sample collection and transport is essential for reliable testing. Following these guidelines aligns with current medical standards and helps support accurate diagnosis and effective TB management.